Hi, I'm Deb. This is an awkward amount of time segment, and we're going to talk about calf strains. So, a calf strain affects the back of the lower leg, and it tends to come about because of sudden excessive force through those muscles or repetitive overuse. The calf is a group of muscles that allow your foot or your toes to point downwards, and they generate propulsive forces through your foot so that you can walk and run or jump. The largest of these muscles are the gastrocnemius and the soleus, and they tend to generate the most force, and so they tend to also bear the brunt of any calf strain. Once you've injured your calf, then you'll experience bruising or swelling, and you'll also get some pain. Now, with the bruising, it tends to go into the down from the calf into the ankle and through down to the toes. With the walking, it can affect the way you walk, and with any activity that where those muscles are being used will be affected as well. The severity of your injury will dictate how long it takes for you to recover. This can range from 2 to 6 weeks, depending on how strict you are with your post-injury care routine. The muscles have a large blood supply, so it tends to mean that the injury to these tissues will resolve reasonably quickly, which is great news. Once you've injured the muscle, you want to apply what we call RICE, which is rest, ice, compression, and elevation. The rest means that you just offload the muscle more than you would when you're just normally moving around. So it doesn't mean that you sit on the lounge and do nothing. It just means that you offload those muscles and don't do quite as much as you normally would. Look, you probably won't want to because it's going to hurt. Secondly, with ice, you want to apply some ice, wrap it in a damp towel, apply it to your skin for 10 to 15 minutes, 3 or 4 times a day. Just be sure to monitor the skin so that you don't get an ice burn. Then you've got compression. You can use tubic grip or an elastic bandage. That will help some of the swelling. And then you've got elevation. And you want to elevate your leg when you're resting up above hip height so that it will also reduce the swelling as well. You can do some exercises in the first stages. Firstly, you want to try and do some ankle pumps or ankle circles. That'll get the muscle going, but without loading it up too much. Then you can move on to what we call heel raises, where you're in standing. You're placing equal amounts of weight through both feet, and then you come up onto your toes with your knees straight. Hold it there for a few seconds and then come back down slowly. Now, if at first it's too painful to put all your weight equally on both legs, then put more weight on the unaffected leg, do the heel raises, and then as you improve and you gain more confidence, you can put more weight through the affected leg. And then lastly, you can do some calf stretches, because as the calf is healing, you want the tissue to be flexible. So we don't want it to heal all tight, because that will increase your chance of re-injuring it. So some calf stretches to the gastrocnemius and soleus. Firstly, you can start with the gastrocnemius, where you place the leg behind you, the affected leg behind you, heel flat on the ground, knee straight, you lunge forward, keep that heel down, hold it there for 30 seconds, and then you bend your knee, and that will change the muscle stretch to the soleus, and you hold that for 30 seconds. That should all help you to recover from a calf strain. There is more that you can do. Thank you for listening, and I'll see you next time at 1:13 p.m. Right, bye.